Hi, I'm Alana Hippenstiel from Pharmacy Times. Before we get started, one of our top articles today discusses the short and long-term impact of COVID-19 on specialty and community pharmacies. There's more of that on pharmacytimes.com. Today, I'm speaking with Samir Balile, the Clinical Pharmacy Program Manager of Giant Food, on the safety measures Giant Food pharmacies are taking to protect patients and staff members upon reopening their doors, and the importance of the flu vaccine during COVID-19. So Samir, I understand Giant Food has announced all vaccinations recommended by the Advisory Committee on Immunization Practices are once again available at its pharmacies across Virginia, Maryland, Delaware, and the District of Columbia. Why has Giant Food decided to make these vaccinations available again?
Yeah, that's a great question. At Giant Pharmacy, we've always taken a position of safety to be our utmost concern for both our patients and our employees. So we wanted to make sure that we followed CDC guidelines and do our part to mitigate the spread of the novel coronavirus. So we do recognize the need to continue to protect our patients from vaccine-preventable diseases. And with that being said, once the CDC guidelines were released and our brand was able to secure proper PPE, we decided to resume and provide scheduled vaccinations, as we felt it's the right thing to do. In any case, any patients that were deferred during the 8 weeks where we suspended the vaccines, we followed up with them and make sure we got them back on schedule.
Right, fantastic. What are some of the safety measures Giant Food pharmacies are taking to protect patients when they come in to receive a vaccine?
Yeah, I mean, we most definitely felt the need to address the post-COVID environment. And with that being said, we added additional screening questions on our consent form, allowing the patient an opportunity to self-report any symptoms they may be experiencing that could potentially be related to COVID-19 infection. Questions per the CDC recommendations were saying, if you've had in the past 3 days any fevers or chills, are you experiencing any shortness of breath or cough? Body aches, or if, for example, you've been in contact with anybody in the past 14 days who suspected active COVID-19 infection. We're also requiring our patients to wear face masks during the entirety of the vaccination process. And if you don't have a face mask, we're also providing those for our patients at no charge. We've also installed plexiglass in the drop-off area of our pharmacies. We're wiping down surfaces both at the register terminal and the immunization administration area after each customer with a disinfectant spray. And as always, in the new post-COVID environment, social distancing is always encouraged throughout the store, in and around the pharmacy. We want to make sure that we're having our patients 6 feet apart while waiting for pickup of the prescription or drop off, as well as receiving any other pharmacy related services. Yeah, and lastly, we've also increased our pharmacy hours on Mondays and Thursdays, allowing our patients to come in at 6 a.m. for those who are immunocompromised as well as elderly.
Fantastic. What about any safety measures Giant Food pharmacies are taking to protect staff who are administering these vaccines?
Yeah, I mean, safety has always been the major focus for Giant Pharmacy and Giant Food overall. Our pharmacists during the administration of vaccinations are wearing face masks, plexiglass face shields, and gloves, of course, to help minimize the risk of transmission during vaccine administration.
Great. And why do you think the flu vaccine remains so important during COVID-19?
Yeah, I think it's more important now than ever to get your annual flu shot. I mean, last flu season, the CDC estimated about 35 million people came down with the flu, and out of those, 490,000 people were hospitalized, and over 34,000 people died. So receiving the annual flu shot will not only minimize that impact on our healthcare system overall, but it'll allow us to allocate those resources to patients who may really need them and are even sicker with COVID-19. Getting your flu shot is also not just about protecting yourself, but it's also more so about protecting those around you who are susceptible to respiratory illness due to their comorbidities or the status of their immune system.
Right. According to a recent report by the CDC, immunization rates declined following the pandemic spread of COVID-19. What do you think the effects of this decline may be?
Yeah, I absolutely think that immunization rates did decline. However, I mentioned that there was also a significant increase in our immunization since we restarted 3 weeks ago. I think people still want to get immunized and do better for themselves and help protect them and their family. I believe moving forward, it'll only continue to increase. With that being said, this flu season, we've actually increased our flu purchases significantly to help meet the suspected increased demand of flu shots. So we're expecting a very high volume flu season, and our giant pharmacy teams will be ready.
Yeah, absolutely. I'm a little curious in relation to vaccine needs and the flu season with that high volume. Do you think there will be any impact on this upcoming flu season in relation to vaccines other than just the increase in number of people coming in? Or do you see that maybe just kind of normalizing?
No, I suspect it to increase. Generally, people, as pharmacists, our job is to educate patients and let them know of CDC and ACIP recommended vaccines that they are eligible for. Ultimately, the patient makes that decision, but I think COVID-19 has only brought to surface some of the health disparities and some of the issues in our communities. And people want to know more. And when people want to know more, that's great. And that's why pharmacists are such a great resources for patients and getting vaccines.
Yeah. Will giant pharmacies continue to offer medication delivery or curbside pickup services even with its doors open to patients?
Yeah, I mean, right now we understand that some of our patients may still not feel comfortable coming into our stores to get their medications. So for right now, we're planning on continuing to do the curbside pickup as well as delivery via mail options for our customers. We're always looking for new ways to meet our customers' needs, and as we get further and further into this, we plan on improving on these two options in the near future. I always tell patients, feel free to reach out to your local giant pharmacy team, and they're usually a good resource.
Absolutely. And I understand giant pharmacists will be available for free consultations as well. Will these consultations be more general, or are there any specific areas available to patients?
Yeah, I mean, what's important to remember is that COVID-19, in my opinion, only expanded on the roles of community pharmacists. I mean, we have been there for our patients and our communities during this extremely trying time, and we'll continue to be there, counseling on over-the-counter medications, as well as seasonal allergies. We're always there to look at a rash, so to speak, and we're there to address pretty much many of your drug therapy-related needs. So we are the most successful healthcare professionals, and I think with doctor's office reducing hours or limiting patient contact, patients are really going to start to rely on their community pharmacists.
Absolutely, yeah. And what do you think the impact of COVID-19 economic decline on medication adherence is? And do you think there are any ways pharmacists can intervene?
Yeah, I mean, of course, like most community pharmacies, we're always monitoring our adherence rates for our patients' medications. So at this point, I haven't seen much of a change, but if you recall back in March, customers were receiving duplicate prescriptions as PBMs were allowing early overrides for the COVID situation. In fact, many PBMs were encouraging this practice. So along with early overrides and PBMs paying for 90-day supplies to be filled in many cases, patients got actually 2 90-day supplies at a time. So this most definitely has helped with adherence. As the months progress, we'll most definitely start seeing an increase on 90-day supplies, I believe, and allowing for better adherence and compliance. But yeah, and I think one of the other barriers that pharmacists were helping patients in was helping individuals who may have lost their job or had a reduction in income. And, pharmacists are a great resource for that. We have access to discount cards. Sometimes, it's as simple as letting your pharmacist know you can't afford your medication, and they can reach out to your physician and potentially suggest a lower cost alternative. yeah, hopefully programs like this, as well as our delivery, curbside, pickup options for our patients, can only help boost adherence rates for our patients.
Right. And do you believe any of the measures taken by giant pharmacies during the COVID-19 pandemic will continue following the end of the pandemic?
Yeah, I think these new ways of conducting business will stick around. I believe, like everybody else in the retail space, giant food and pharmacy was confronted with challenges that we had never before seen. So moving forward, and I think as states start to reopen, we're confident that these precautions will continue to be in place as we adapt to the new norm, right? We are different than our competitors, I guess, is the special thing about the giant pharmacy, giant food landscape, in that we are a pharmacy within a grocery store. And people, those who are especially those who are immunocompromised, are always going to seek ways moving forward, I think, on how to minimize their exposure to potentially contracting COVID in a public setting. So when you talk about giant food and giant pharmacy, giving them that option to have one-stop shop really puts our customers' minds at ease, I think.
Yeah, absolutely. Thank you so much for taking the time to speak with me today, Samir. Now let's hear from some of our other MJH Life Sciences brands on their latest headlines.